FORA.tv. The world is thinking.
Avoidable hospital admissions cost Americans billions of dollars each year and unnecessarily expose patients to medication errors and hospital-acquired infections. The chairman of the Medicare Payment Advisory Commission recently testified before Congress that, quote, the kinds of strategies that appear to reduce avoidable readmissions include preventing adverse events during the admission, reviewing each patient's medications at discharge for appropriateness, and communicating more clearly with beneficiaries about their self-care at discharge, end quote. Now, those sound like reasonable steps that would improve the quality of care. The problem is that when hospitals adopt those strategies, they receive fewer admissions and their revenues fall. Now, the left frequently points to these perverse incentives and the quality failures that result as evidence that healthcare is too complicated to be left to the market. Yet that claim doesn't stand up to scrutiny. Markets have developed health plans that excel in these dimensions of quality. We've heard about some of them today. In fact, the first health plan that the market developed was created in Los Angeles in 1929. The irony is that these are not market failures, but government failures. The entity that's penalizing those quality efforts is the federal government, most often the Medicare program. And the healthcare reforms that the left is now pushing through Congress, I submit, promise to make that situation much, much worse. And why is this? Well, the way that a free market promotes quality healthcare is largely through what seems like an obscure form of competition, and that's competition between different payment systems, between different ways of paying doctors and hospitals. Because different payment systems encourage healthcare providers to promote different dimensions of quality. For example, under what is called prepayment or capitation, providers receive a fixed budget for a defined patient population. Prepayment encourages providers to invest in things like electronic medical records, care coordination, error reduction, even comparative effectiveness research. Kaiser Permanente, which is a prepaid health plan, actually leads the industry in these areas precisely because prepayment allows the for-profit Permanente Medical Group to keep any money it saves by using, say, disease management to avoid hospital admissions or using electronic medical records to avoid duplicative tests or medical errors. Fee-for-service payment, on the other hand, pays providers an additional fee for each additional service or hospital admission. Fee-for-service payment promotes dimensions of quality like choice of providers and gives patients easier access to more intensive services, but it also penalizes providers that try to improve those other dimensions of quality. Now, a free market, or even a reasonably free market, I would argue, requires a level playing field for all payment systems, where competitive pressures can force each payment system to improve on the dimensions of quality where they're weak, to overcome the perverse incentives that exist in their own payment system. So when prepaid plans like Kaiser Permanente offer electronic medical records, fee-for-service providers would have to do so as well, or they would lose customers. Those customers would go to Kaiser for more convenience. The same would happen in reverse. Prepaid plans have an incentive to skimp on necessary care because the plan also gets to keep that money as well. But competition from fee-for-service plans would discourage them from doing so. The U.S. healthcare sector, however, is not that reasonably free market. Rather than allow a level playing field, government tips the scales toward fee-for-service. The federal Medicare program is the largest purchaser of medical services in the world, and it operates largely on a fee-for-service basis. The tax code, the federal tax code, encourages fee-for-service payment and discourages prepayment. State-level clinician and insurance licensing laws, the things that keep you from purchasing insurance from that's licensed and regulated by another state, or prevent clinicians from taking their licenses across state lines to practice medicine. Those also discourage or place disproportionate burdens on prepaid health plans. With all of these interventions, government creates a steady stream of revenue for low-quality providers and penalizes any quality innovations, and these include electronic medical records, barcode scanners for prescription drugs that help avoid medical errors, surgery checklists, any innovation that would have the effect of avoiding unnecessary services.